A patient is being treated with the beta blocker for hypertension. Which of the following describes the effect of beta blocker on end diastolic volume, blood pressure, contractility, heart rate, and ejection time? So first option, no effect, blood pressure decrease, contractility no effect, heart rate decrease, ejection fraction no effect. Option B, decrease in end-diastolic volume, decrease blood pressure, decrease contractility. So contractility should be decrease. Okay. Increase heart rate, no, it decreases the heart rate. So C, decrease end-diastolic volume, decrease blood pressure, decrease contractility, decrease heart rate, decrease ejection time. So it doesn't decrease the end-diastolic volume. D, increase in end-diastolic volume, decrease blood pressure, decrease contractility, decrease heart rate, and increase the ejection time. So I think D is the right option till now. E, decrease in end-diastolic, no, it increases the end-diastolic volume. So how it increases the end-diastolic volume? Like for example, this is your heart, okay, and these are the two ventricles. So I will consider only the left ventricle. So this is what the left ventricle valve. Okay. So beta blockers, they inhibit or the slow down. First, they slow down the heart rate, and second, they reduce the contractility. They decrease the contractility. So when the contractility decrease or the heart rate decrease, for example, this heart is beating 80 beats per minute, and this heart is beating with, for example, 120 beats per minute. So this heart is beating slower than this heart. It means that when the end diastolic volume, okay, during the filling of the blood to the left ventricle, end diastolic volume, this means that the volume during the ventricle completely dilated. So it dilate, it fill with the end diastolic volume, and then eject out. So in this case, there is a very rapid heart rate. It means that it is not giving enough time for the ventricle to fill completely. So the end diastolic volume in this case is less because it is not giving the full time. Okay, it is not giving enough time for the ventricle to dilate completely and fill and then contraction. No, or rather in this case it is giving enough time for the heart, for the ventricle, in order to fill up. Once it full, then contract. So here cardiac output or the ejection time is increased and the filling time is increased and diastolic volume is increased. But in this case, when the heart rate is so high, it is not giving enough time for the ventricle to fill completely. So end diastolic volume is decreased, the ejection fraction or the cardiac output is decreased, and the ejection time is decreased, and the filling time is also decreased. So beta blocker, what it do? For example, if we give this patient beta blocker, it change the heart rate or slow down the heart rate to 80, for example 80, 60, 70. Okay, this means that the beta blocker, first, it is decreasing the heart rate, and second, it is decreasing the contractility. So it is changing the heart from a situation of rapid filling to the slow filling. It means that now the heart is getting enough time to fill completely and to contract properly and to eject out the blood. Okay, so the best option, that it increases the end diastolic volume, it decreases the blood pressure, it decreases the contractility, it decreases the heart rate, and increase the ejection time. So the best option is option D. And this is the work of the beta blocker. Thank you.